readmissions to the hospital occur in that first 30 days when a client is home. Whether it's a safety issue or whether they get their medications mixed up, we want to keep that from happening.
Cardinal Hill Home Care provides comprehensive nursing and therapy care in the home setting.
We look at what their individual needs are. They may have all kinds of needs, nursing, therapy needs, speech needs, and we can use all of our technologies from the continuums, from the hospitals, from the doctor's offices, whatever's available in the community to help them transition.
Cardinal Hill Home Care serves 5 central Kentucky counties. The client's physician must prescribe home care services and the client must be homebound.
And homebound doesn't mean bedbound. That's very different, or that they can't move in the home. It means that it is a taxing effort for them to go out and do anything.
A unique plan of care is designed after meeting the client and assessing their needs. The Cardinal Hill Home Care team will also meet with the client's doctor, who will review the plan of care.
If you've come from a hospital, everything is accessible in the community, but your home, if it was built before the ADA guidelines were implemented, walkers aren't as mobile in your home as they might be in the hallway in the hospital or in the doctor's office. Just transitioning from room to room, turning tight corners with either a wheelchair or any type of assistive device, whether it be a walker or a cane, makes it a little more difficult. And even though people are so anxious to return to their own home, we see a lot of anxiety. This is much harder than I thought it would be. That anxiety sometimes is something we have to work with them and make sure that they're safe and that they think through those things. They give themselves enough time to get all the things that they need done correctly and safely, and then that way they can just continue to get stronger and build themselves back up to where it does become automatic again and they don't have to think about it.
Cardinal Hill Home Care registered nurse will review the client's medicine to ensure that they are taken properly and meet other nursing needs, including physical exams and wound care. Physical, occupational, and speech-language therapies are also offered.
Cardinal Hill is unique in the fact that we have so many services we can offer, particularly in the different areas of rehab and in the technology that we have available. Sometimes on an inpatient unit, a client may try one of our technologies, whether it be Bioness or VitalStim home care at Cardinal Hill, because we have that technology available.
Home care services are as advanced today as some of the other continuums, whether it be outpatient or wellness programs. Some of our clients are much sicker initially and they're needing some more medical monitoring. We have the technology available to use telehealth, where we can actually put a Bluetooth device in the client's home and monitor the things that are the most unstable for them at that particular point, whether it be their respiratory breathing, oxygen levels, whether it be their glucose, their diabetes. We set parameters with the physician and look at what's an acceptable range for that client at that point. And if those readings are different, or they're too low or too high, and that client is going to need some intervention, we get an alert in our office where a nurse can call that client back. We do have a nurse who's available on call 24 hours a day, so anytime a client would take a reading or have a question or be confused or concerned about something, someone is available to help them.
We want to keep them progressing medically as well as functionally in a way that's getting them towards independence instead of something slipping backwards.